Here we have a CT scan of the paranasal sinus in 40-year-old with history of nasal obstruction sent by a primary care physician or general practitioner. So what we see here is in the paranasal sinuses there is mild mucosal thickening. The nasal cavity appears quite unremarkable. There is mild deviation of the nasal septum. But as we see here in the nasopharynx, it is completely opacified by soft tissue density, which is much better appreciated on the sagittal sequence. The mass is quite large and it is irregular at some places, and it is much larger than a benign adenoid hypertrophy. And also, the patient age is 40, which we should not be finding such a large adenoid. So, it is very, very important to look for adenoid in every patient who is sent for CT of the paranasal sinus. And also, we need to look very, very carefully what is happening. Is it just a benign adenoid hypertrophy or much more than that? On CT scan, it is not possible to differentiate between benign adenoid hypertrophy and non adenoid tumors of the nasopharynx, especially on the CT paranasal sinus, because CT paranasal sinus is a non contrast examination. We need to look carefully at the parapharyngeal spaces to see if the parapharyngeal spaces are bilaterally symmetrical or not. We need to comment how large the enlargement of the nasopharyngeal mass is. In the conclusion, you can comment this may represent. In conclusion, we need to provide the differential as significant benign adenoid enlargement, but also we need to raise a differential diagnosis of a primary non-adenoid nasopharyngeal tumor such as lymphoma or nasopharyngeal carcinoma. Looking at the attenuation and smooth margins throughout except for a couple of regions, features are less likely to represent nasopharyngeal carcinoma and likely to represent significant benign adenoid enlargement or a lymphoma. We need to keep a non-adenoid tumor in the differential in this patient, in these kind of patients, and we need to raise this report as urgent and tell the primary care physician to urgently refer to the ENT team for urgent evaluation to look into the nasopharynx and, if necessary, do biopsy and histological correlation. This case shows the importance of reviewing the nasopharyngeal region in every patient of CT of the paranasal sinus, and not to call every soft tissue tumor in the nasopharynx as a benign adenoid hypertrophy.